Hello, everyone, and welcome back to Dentist's Coffee Time.
Great to be here.
Today, we're going beyond just, fixing a single tooth. We're really planning to dive deep into the fundamentals, the core ideas behind designing a smile that feels truly harmonious, balanced.
That's right. Our goal today is to unpack these core principles, the sort of geometrical and visual rules that make dental aesthetics work.
So not just looking at the pretty after photos.
Exactly. We're digging into the concepts underneath, things like visual balance, why the direction of lines matters so much, and something that often gets missed, the dark space around the teeth.
Negative space, you mean?
Negative space, yeah.
Yeah.
We'll talk about why that's so critical.
Yeah.
So this should give everyone, clinicians definitely, but really anyone interested, a clearer roadmap for evaluating things before treatment even starts. Hashtag tag 2, the foundational principle of balance.
Okay, so let's unpack that first one. Balance. When we talk about balance in a smile, what are we really looking for? I mean, teeth are 3D objects, right? But we're aiming for a kind of visual stability.
Balance is absolutely foundational. It's all about visual stability.
The sources use a really good analogy, actually.
Okay.
Imagine you put a circle right smack in the middle of a box. It feels stable, right? Anchored.
Yeah, centered.
But if you nudge that circle off center, even just a little bit.
It looks weird.
Yeah.
Unstable.
Exactly. It loses that stability. The material we looked at described it as looking thin or like it's lost its visual weight.
Lacking visual volume. That's a great way to put it. That feeling of discomfort you get with asymmetry.
Right. And in dentistry, that instability translates directly to a lack of bilateral symmetry in the mouth.
So the left side matching the right side.
Precisely. That stability is tied directly to bilateral symmetry.
Mm.
But getting there, well, it starts with something surprisingly tricky.
Mm-hmm.
The midline. Hashtag A. Midline symmetry.
The midline. Okay.
Yeah.
Why is that so challenging?
Well, judging a vertical line like the midline of the face or teeth is actually much harder than you'd think.
Harder than horizontal. Oh, much harder. Think about a horizontal line, the horizon, a picture frame on the wall. If it's tilted even slightly,
You notice it instantly.
right, our eyes are incredibly sensitive to that. It's probably, evolutionary, gravity, staying upright. We're tuned to the horizontal.
But flip that to vertical and it all changes.
It really does. We don't have that constant, reliable vertical reference built in unless you're literally using a plumb line on the patient.
Which we're generally not doing chairside.
Exactly.
Mm.
So our ability to spot slight deviations in the vertical midline is, well, it's pretty imprecise.
Yeah, and here's where it gets fascinating based on the sources. It's not just patients who misjudge it. Clinicians do too, the self-perception error.
Absolutely. The source material gives a great example. It says, if a clinician tries to draw the midline freehand,
Yeah.
they often get it wrong the first time. And interestingly, often tend to draw it slightly to the right on the second try.
Really? To the right?
Yeah. It often takes objective tools, like digital calipers or specific software to actually measure and find the true center relative to other facial landmarks.
Wow. That really highlights why we need to move from just eyeballing it or relying on feel to actual measurement in aesthetics.
Definitely. If we can't reliably trust our eyes for something as basic as a slight midline shift.
Then relying on feel for complex restorations is asking for trouble.
It is, because even a minor deviation throws off that whole feeling of balance. Your eye might not know why it looks wrong, but it picks up on that lack of centering. Hashtag tag B, achieving balance in 2 dimensions.
Okay, so balance isn't just the midline. It's a two-dimensional thing, needing that left-right symmetry. How do we ensure the whole structure, the sizes, everything achieves that stability?
It requires complete structural equivalence, visually speaking. When we say left and right have to balance, we mean the overall shape. The composition needs to be symmetrical.
So if one side looks heavier visually, maybe a slightly bigger incisor or canine.
Exactly. If the visual mass on the left seems heavier than the right, the whole thing feels unstable or thin, like that analogy earlier.
So it's not just one tooth, it's the cumulative effect. You have to step back and see the smile as two halves, almost mirror images, designed to anchor the whole look.
Precisely. If that fundamental bilateral symmetry isn't there, then any fancy stuff you do later, contouring, color effects, it won't quite land right because the foundation, the anchor, is broken. Okay, so now let's zoom in a bit onto the teeth themselves. Balance isn't just about where things are placed, center versus off-center. It's also about the posture of the teeth.
Posture, you mean the angle?
specifically the angle of the long axis of the tooth, what we call axial inclination. And this is where it gets really interesting geometrically.
Axial inclination, right. The sources really emphasize this, especially the angle on the front surface, the labial side. So what happens when those lines, those angles go wrong?
When those lines diverge, the whole visual flow
Yeah.
it breaks down. The key thing we're usually aiming for visually is containment. Hashtag tag tag A, the direction of tilt.
Containment. Okay, so what does the opposite look like? The unbalanced version.
Let's start there. Unbalanced inclination. This is when the long axes of the teeth, especially the centrals and maybe the laterals, slope outward.
So pointing away from the middle towards the corners of the mouth?
Exactly, diverging. That creates immediate visual instability. It looks like the smile is scattering or pushing away from the center. It's just not aesthetically pleasing. It feels unbalanced.
Okay, so outward slope feels dispersive, scattered.
Hmm?
What's the ideal then? How does that create containment?
Ideally, the lines should slant inward. Imagine the long axes of the centrals, the laterals, slightly converging as they go up towards the gums, leaning a little towards the midline.
Ah, I see, like they're pointing inward slightly.
Right. When those lines converge inward, they visually contain the whole composition. It creates this really powerful sense of unity, of cohesion, almost like a stable pyramid shape that draws your focus inward, centers the smile.
That makes a lot of sense geometrically. So inward slope gives cohesion. Do the sources say how much of an inward slant? Is there a magic number or is it relative?
It's generally relative. It depends on the individual case, the face, the arch form, but the fundamental direction needs to be inward.
And if it's not, if the teeth naturally slant outward,
Well, that's a problem. Because if the underlying tooth angle is wrong, trying to fix it just with the restoration, say a veneer or a crown, gets difficult. You might end up needing a really thick margin.
or having to prep the tooth much more aggressively just to change that apparent angle.
Exactly. You might have to remove a lot of healthy tooth structure simply to create the illusion of the correct angle. It's really a geometric failure that ideally needs addressing earlier.
Right. That sounds like something you can't just fix with the final filling or veneer. It points towards needing maybe ortho first, which I think we'll get to later. Hashtag tag tag BB. Multiple factors in balance.
Absolutely. Axial inclination is one really critical piece. But balance itself, it's holistic. It's affected by several visual things working together.
Okay, so besides the angles, what else did the sources mention that can throw off symmetry and balance?
Well, first, the obvious one. Left-right asymmetry in just the basic shape or position of the teeth.
Mismatched shapes. Got it.
Second, size balance. The sources are really clear on this. Even subtle differences in size between corresponding teeth on the left and right,
Yeah.
they just kill the feeling of symmetry.
Our eyes are that sensitive to size differences in mirrored objects.
Incredibly sensitive, yes. And finally, something that isn't about shape or position. Color.
Ah, color balance.
Yes. If the color isn't evenly distributed, say one central incisor is noticeably different in brightness or shade compared to the other.
Even if they're perfectly shaped and aligned.
Even then, it contributes heavily to that feeling of imbalance. A visually stable smile needs symmetry in how light reflects, the shade, the contour right across that midline. Any difference breaks the anchor. Hashtag tag Vivi. The role of negative space.
We spend so much time focusing on the teeth, right? Their size, shape, color, angle. But the sources pointed to something else, something equally vital. The darkness around the teeth. This idea of negative space. Can you elaborate on that? What is this native space or negative space in dentistry?
Right, negative space. It refers to those dark shadows, the sort of black voids you see when someone smiles broadly.
Okay.
The technical term for this area is the buccal corridor.
Mhm.
Basically, it's the dark space between the outer surfaces of the back teeth, the maxillary posteriors, and the inside corners of the mouth when someone smiles.
So between the teeth and the cheeks, essentially.
Exactly. And the key thing is, this darkness isn't necessarily a flaw we need to eliminate. It's an aesthetic component we have to manage.
Manage, not eliminate. Okay, so what's the goal?
The aesthetic goal is for the negative space to be appropriate. Not too much, not too little. It acts like a visual frame.
A frame. How so?
It provides necessary contrast. That darkness helps highlight the teeth, especially the front ones. It gives the smile depth, dimension. If you get rid of all contrast, you often lose visual interest. Hashtag tag A. Defining the aesthetic goal. We sometimes think, oh, we need to fill that space, make it all teeth. But that's often not the ideal. An appropriate buccal corridor gives a visual recess. It separates the main focus, the anterior teeth, from the surrounding cheeks and lips.
So it enhances the dominance of the front teeth by framing them.
Precisely. It helps
Okay.
make it pop. It's about finding that sweet spot, that balance point between too much distracting darkness and not enough contrast. Hashtag B, problems of imbalance in space.
Okay, so what happens when it's unbalanced? Let's take corridor excess first, too much black space.
Right. If that space, that buccal corridor, is too wide, and this often happens if the patient's dental arch is naturally narrow, or maybe F-shaped as some describe it,
Okay, a narrow arch form.
then the dark shadow really dominates the picture. It can look like a tunnel.
A tunnel effect, yeah.
Those deep, dark voids pull your focus away from the teeth. It creates a visually distracting look. The teeth might seem isolated or like the arch is pinched in. It's generally seen as an aesthetic negative.
Right, and the flip side, corridor deficiency. Basically no negative space at all.
Exactly. This can happen if the arch is very wide and the teeth fill the entire visible space right out to the corners of the mouth.
Wall-to-wall teeth.
Pretty much. And the result is a total lack of contrast. It's just all teeth. And while you might think that's good, this lack of appropriate negative space can also look wrong aesthetically.
Why is that?
Because there's no dominance, no visual framing. The smile can look flat, maybe too wide, sometimes even a bit aggressive because there's no relief or depth provided by those subtle shadows.
That's really interesting. So no space looks flat, too much space looks distracting. It means for the clinician, thinking about arch width and where those back teeth sit is just as crucial as analyzing the front teeth. You've got to frame the picture.
You absolutely do. Hashtag VVI. Tools for preoperative assessment.
Okay, so understanding these principles, balance, line angles, negative space, it's one thing. But how do we actually translate this, fairly high-level aesthetic thinking into concrete steps in the clinic? When you're standing there with the patient, how do you systematically, objectively measure these things?
Yeah, this is where systematic evaluation becomes absolutely key. The source material really emphasizes moving beyond just feeling it looks right and turning these principles into a quantifiable checklist.
From art to engineering, almost.
In a way, yes.
Hmm.
We need structured assessment.
Mhm.
Hashtag A, the NYU facial analysis chart. And the sources specifically mention some charting methods, particularly ones developed at the NYU College of Dentistry. There's an NYU facial analysis chart that sounds crucial.
Okay, a specific chart. What's its main purpose?
It's designed for comprehensive pre-surgical or pre-treatment evaluation. It functions as a standardized checklist for assessing the smile and related facial features.
A checklist is always good for consistency. What kinds of treatments would this be most useful for?
Really, anything involving aesthetics. Full mouth reconstructions, obviously, but also cosmetic procedures like veneers, even orthodontics.
So ortho, too.
Yes, because you need to assess the starting point accurately. The chart helps the clinician systematically check various criteria across different planes, horizontal, vertical, to make sure the plan aligns with aesthetic norms or documents where it deviates.
So it standardizes the evaluation, make sure you don't miss a critical deviation because you were just focused on, say, the shade of one tooth.
Exactly. It forces a comprehensive look. Hashtag B. Assessing horizontal lines.
And where does this evaluation typically start? The sources mentioned horizontals.
Yes, the evaluation often begins by aligning the horizontal facial landmarks.
Why start with horizontals?
Because, as we discussed earlier, our eyes are most sensitive to horizontal lines being off kilter. So it's about establishing that primary frame of reference first.
Makes sense. So which specific horizontal lines does the NYU chart have you check?
Two main ones mentioned were, first, the pupillary line, the line connecting the center of the pupils, and second, the commissure line, which connects the corners of the mouth.
Right, the lip corners. And the goal is...
Goal is pretty straightforward. Determine if these lines are level, basically normal, or if there's a cant, a deviation. And if there is, which way does it tilt?
And why does that matter for the teeth?
Because any tilt in those lines, especially the commissure line, has to be considered when you're designing the incisal plane, the edge of the front teeth. If the lip line is canted, making the teeth perfectly level with the ground might actually look wrong relative to the lips.
Ah, so the chart forces you to register the teeth relative to their immediate soft tissue frame, not just some abstract horizontal.
Precisely. It documents any existing facial asymmetries that the dental work needs to either accommodate or perhaps help camouflage. It turns observation into objective data. Hashtag CC. Technology integration. Smart design.
Now, doing all this geometric analysis, measuring angles, proportions, historically that sounds really complex. Maybe something only a master technician could do well with manual drawings. The sources mentioned it being out of reach.
It certainly required a high degree of skill and time, yes.
Yeah.
Manual analysis and drawing were complex.
But technology is changing that. The sources mention software like Smart Design. How does that help?
Technology is really the great equalizer here. Software like Smart Design lets the clinician take standardized patient photos, facial shots, retracted smile shots, different angles.
Okay, good photos are key.
Absolutely. And then the software allows you to overlay geometric analysis tools directly onto those images.
So what can you measure or check using the software relating back to the principles we've discussed?
Well, it simplifies things like calculating ideal tooth sizes and proportions, like the golden proportion if you use that. You can digitally draw the facial midline and instantly compare it to the dental midline, quantifying any deviation.
So no more error-prone freehand drawing of the midline.
Right. And critically, you can accurately measure things like axial inclination. Are those lines slanting inward correctly for containment? You can visualize the buccal corridors. It helps assess the negative space.
So it lets you digitally simulate and plan the outcome before you even touch a handpiece.
Exactly. It makes establishing that ideal balance, the line angles, the size ratios, much more precise and predictable. It helps the clinician make objective decisions about how much tooth preparation might be needed, or if tooth movement is required before diving into the final restorations. It takes the guesswork out. #tag 6. Multidisciplinary treatment for minimally invasive aesthetics.
In all of this, it really connects to the bigger picture in dentistry today, which is, well, the ultimate goal is usually achieving the best possible aesthetics and function, but doing it with the least amount of intervention.
Minimally invasive dentistry, MID, is not just a buzzword, is it?
Not at all. It's really a foundational principle now. Ethically, structurally, we want restorations to last, and that means preserving as much healthy tooth structure as possible.
Okay, so preserving tooth structure is paramount. But that creates a challenge, doesn't it, when the teeth aren't in the right position to begin with, if there's significant misalignment. #tag Taily. Elevated standards in dentistry. It does create a challenge. The modern standard really pushes us to save enamel and dentin. So if a patient comes in and their teeth are, say, severely tilted outwards.
That unfavorable axial inclination we talked about?
Right. Or maybe they have significant gaps or crowding.
Yeah.
Trying to fix those issues only with restorations like veneers, well, it often forces you into aggressive tooth preparation.
Meaning you have to grind away a lot of healthy tooth just to make space or change the apparent shape or angle.
Exactly. And that compromises the tooth long-term, increases risks, and it kind of violates that core principle of minimal intervention. This is where understanding those geometric principles we discussed becomes critical for planning the sequence of treatment. #tag EVB. The strategic role of orthodontics.
So if veneers alone mean too much grinding, what's the alternative?
This is where strategic, sometimes limited orthodontic treatment becomes so important. The source has highlighted a case example that illustrates this perfectly. A patient needed aesthetic improvements, but first, they underwent about 9 months of limited orthodontic therapy, just focused on repositioning the teeth needed for the aesthetic zone.
9 months of braces or aligners before veneers? Why was that necessary? Why not just jump to the veneers?
It was necessary because the starting point was too compromised. The patient had issues with their bite, the overjet, and crucially, those non-ideal axial inclinations.
The teeth were tilted wrong.
Yes. If the restorative dentist had just tried to slap veneers on to correct the angles and spacing,
They would have had to prep heavily.
very heavily,
Yeah.
probably grinding deep into dentin on the front surfaces, simply to create enough room and change the visual posture of those teeth.
Okay, so the ortho wasn't just for straightening, it was strategic preparation for the veneers.
Precisely. The orthodontic movement served to create the ideal canvas.
Hmm.
By moving the teeth into the correct position, first achieving those ideal inward axial inclinations, closing spaces appropriately.
Then the prep for the veneers could be minimal.
Exactly. Ideally, enamel-only preparation. The ortho does the heavy lifting of positioning the teeth correctly according to those geometric principles. Then the restorative phase becomes mostly additive or just requires very conservative shaping rather than an aggressive reduction.
It's a prerequisite to actually meet that minimal invasion goal while still getting the top-tier aesthetic result.
It often is. Without that preliminary movement in challenging cases, the clinician is forced to compromise. Either accept a less than ideal aesthetic outcome or violate the minimal invasion standard by over-preparing the teeth. #C synthesis.
So this really brings everything together, doesn't it? Understanding balance, lines, negative space. It's not just for diagnosis, it actually dictates the best way to sequence the treatment.
It absolutely does. It confirms that often a multidisciplinary approach, maybe combining some limited ortho with veneers or other restorations, is the only way to meet today's high standards for both function and aesthetics while being truly conservative and preserving tooth structure long term. The principles guide the pathway. Handshake tag Tezo betting.
Wow, we've really covered a lot of ground today. We went from the surprising difficulty of seeing a crooked midline all the way through the geometry of tooth angles, the importance of those dark spaces, the buccal corridors,
Hmm.
and finally, how all these principles really shape modern, minimally invasive treatment planning, sometimes requiring that multi-step approach.
And it's valuable knowledge, right?
Hmm.
Understanding why things look good or why they don't. These classic aesthetic principles, cohesion, balance, horizontal alignment, proportionally explain the successful outcomes we strive for. And thankfully, tools like that NYU chart or digital design software make objective analysis more accessible now.
That definitely helps translate theory into practice, which actually brings up a really important practical question for clinicians listening.
Okay.
Considering this rising standard of minimally invasive dentistry and how much we want to preserve tooth structure for the long haul, where do you think the line should be drawn? When is it okay to use restorations like veneers to sort of mask minor misalignments or slightly off angles versus insisting on prerequisite orthodontic movement first, even for smaller issues, just to achieve that truly ideal, minimally invasive prep? How should clinicians weigh the perfect aesthetic outcome, the May-D principles, and maybe the patient's willingness or unwillingness to go through longer multi-stage treatment? That feels like a key decision point in modern smile design.
It's a very relevant question, finding that balance.
Something to think about. Well, thank you for joining us for Dentist's Coffee Time.
My pleasure. Bye-bye.
Mm.
1 second pause before audio video ends.